Can you hear me without the microphone? Great, because I hate microphones. Okay, as Joe said, my name's Tony Marquacci. I'm a county detective here in Westmoreland County. Just so you know, I have a little bit of idea what I'm talking about. I've been a detective now for 33 years. 27 of those years have been exclusively devoted to narcotics enforcement here in the county. Used to work undercover a lot, myself and my partner. Those days are pretty much gone. Doing things like this, I kind of burned my own identity out. A couple things I want to talk about. Joe hit on one of them is alcohol. And I have no problem in having you guys spread the word. Parents who endorse children drinking at their home because it's safe at their home will get arrested. My office, I work in the district attorney's office for John Peck, our district attorney. He will prosecute. Next thing I want to cover, and it's something that's often overlooked. Recently, there's been some legislation in some states where possession of a personal amount of marijuana is legal now. I think you guys all know what I'm talking about. I don't know where they do this, get this from. Marijuana is a drug. Just to give you some examples of what I'm dealing with out on the streets, because nothing will make me madder than a parent who tells me, my son's just smoking a little bit of weed, that's all. It's nothing I didn't do when I was young. I'm here to tell you, marijuana today is outrageous. The THC, which is the chemical in marijuana which causes the euphoric feeling, it's through the roof. So I like to tell everybody, you guys remember that sitcom on TV, Taxi? Christopher Lloyd played Jim. A classic burnout. Smoked a little bit too much weed in his day. My problem today is that I'm talking to 14, 15-year-old kids who are suffering from burnout. They haven't been smoking weed all that long. The marijuana is that potent. I'll give you an example. An ounce of marijuana, Terry and I used to buy it all the time. An ounce of marijuana is about this much in a full-top sandwich baggie. You need that? It's about this much in a full-top sandwich baggie. We used to be able to buy an ounce of marijuana for $40 to $60. Today, I'm paying somewhere between $400 to $500 for an ounce of marijuana. Drugs are simple supply and demand. Trust me, there's a big demand and a large supply out there. So that's not why it's not like the gasoline shortage we all hear about. There's a lot of marijuana out there. The marijuana is that potent. It is addictive. And I defer to you guys, anybody that's tried it. It is a gateway drug. But now one of the other things I want to talk about. Opiate addiction is through the roof here in Westmoreland County. I don't know if any of you have ever seen heroin or other opiates over the counter. We have some here that everybody can take a look at. There are no free samples. But I do want to explain to parents what it looks like, because I feel that's so important. So many parents have come to me and said, Tony, I never knew my daughter was using heroin. I used to pull these stamp bags out of her jeans when I would do her laundry. Never knew what they were. I want you people to be educated tonight on what to look for. Now, just to give you an example, a stamp bag, they come in all different colors and shapes and sizes. But basically all it is a glassine, they call it a glassine baggie. It's a wax paper bag. A quantity of heroin is placed into the bag, it's folded up to it's about the size, even smaller than a postage stamp. And that's how it's sold on our streets. For those of you in the Franklin Regional Murraysville area, you can pick up a bag of heroin today on our streets for about $8. As you go east, away from the city of Pittsburgh, the prices go up. They put a tariff on it. The further they come out of the city to sell, the more expensive it is. Now, I want you to think about something. Each one of those stamp bags that sells for whatever, $7, $8, $10, contains typically either somewhere between 1/100th to 3/100ths of a gram. You guys all know what that is, right? Don't worry, I never did till I started working dope. I were to take a sugar packet, an equal packet, and lay it out on the table, dump it out onto the table, if I were to take a razor blade and break that up into 100 equal parts, anywhere from 1 of those parts to 3 of those parts are in a bag of heroin. So there's minuscule samples in each bag, and it's killing people. Why is that? We always hear that there's a bad batch of heroin going around because people were dying. Don't believe it. It's very good heroin. Like I said, we've been buying drugs a long time. 15 years ago, when I used to buy heroin on our streets, it was roughly 8% pure. Today, what we're seeing is most of the heroin is in excess of 80 to 90% pure. And believe me when I tell you, I'm always asked, where do the drug dealers hang out? Anybody have any ideas?
Everywhere.
Exactly. I did a drug talk one time in the city of Greensburg for the first responders, and one of the firemen asked, where would I find heroin in the city of Greensburg? And one of the city detectives said, within a block of your house. Believe me when I tell you, we've arrested a lot of people for heroin, both usage and sales. Most of the kids I deal with are very good kids from very good families. This is not an inner city drug any longer. It's in our community. I promise you, it's in our neighborhoods. As you listen to the presentation tonight, think of that. Everybody wants to associate a heroin addict as an individual lying in the streets in the inner city with a needle in his arm in the gutter. Trust me, I haven't seen that in years. Every single kid that I deal with, or person that I deal with, is a good kid from a good family. They made a very poor choice, and now they're dealing with the addictive qualities of heroin. Also, I like to caution people, you know we live in a pain-free society, right? Anybody who's gone through any surgical treatment, what's the first question asked of you whenever you wake up? On a scale of 1 to 10, what's your pain level? Because we cannot feel pain. I caution parents all the time. Just because a doctor prescribes a medication, whether it be Vicodin, Percocet, or OxyContin gets the big notoriety. Trust me, Vicodin and Percocets are just as bad. Actually, I hear of more people getting addicted starting off on Vicodin. I like to think of myself as a trained professional. I never was referred to as a professional until tonight. I'm a trained narcotics officer. I truly thought that a Vicodin was a little bit stronger than a Tylenol for a lot of years. It's not. It's a narcotic drug, which leads to addiction. And I caution any parent, when your child gets their wisdom teeth out, sports injuries, what have you, I caution you on that. Don't go into it blindly like so many other parents have. Doctor says that my son could have 6 pills a day, so I give him 6 pills a day. What will happen is that the sports injury will heal. The addiction is still there. So I caution you on that. Now, I brought with me a variety of different drugs that we'll be guarding. But when we're all done up here today, anybody who wants to see them, please feel free to come over, ask us any questions you may have. We'll try to explain them to you. So thanks a lot, and you are all to be commended for being here tonight. Thank you.